who have a lot of problems in their head.
Now, nutrition is a key component of health and development that health experts equate to improved infant, child, and maternal health, among other benefits. Although progress has been made to reduce national stunting rates among children under 5, that gains are not equitably distributed across the country. In the following report, our health and science reporter Gloria Milimu tells us how Kitui County is transforming its nutrition indicators through leveraging of different approaches like cash transfers.
Health experts argue that nutrition is an important determinant of population health. So much so that better nutrition is linked to improved infant, child, and maternal health, among other critical components of health and development. However, as nations of the world strive to firm up nutrition security in a bid to ensure that individuals and families have access to safe, nutritious, affordable, and sufficient nutrition, this critical facet of health and development remains under threat. Counties like Kitui, that is home to over 1 million people, have felt firsthand the impact of malnutrition that has been exacerbated by climate change over the years. Elizabeth Musyoka, a resident of Imale in Kitui County, is among those who have battled the uninvited guests in homes that seem so common here, malnutrition.
Tulikuwa tunakula vibaya na watoto wangu, chakula ilikuwa shida.
Just a few meters away from her home is Purity Annas. On the day we visited her home, we caught up with community health promoters who had come to check on the progress of one of her children who had been diagnosed with malnutrition a few months ago during a mass screening exercise in the area.
Tulienda Kinakoni, tukapimiwa watoto. Mtoto wangu alikuwa anaendelea vibaya.
At the facility level, cases of malnutrition had become way too common, as explained by Jacob Mwanzia, who is the nurse in charge of Kasala Health Center in Kitui South.
By that time, cases went up to 84 cases of severe acute malnutrition. Kuna wale moderate, which was over 100.
Similarly, the high numbers of children under 5 whose health remained at stake due to malnutrition were also being witnessed at the Musavani dispensary in Mwingi North, according to Simon Wendwa, who is in charge of the facility.
We were receiving children under 5 who had malnutrition, whereby the mark was reading 11.5 centimeters and the height. So the things were not good at that time.
Malnutrition in every form presents significant threats to human health. If left unaddressed, child health experts warn that its impact can be detrimental on the well-being of a child. To counter the effects of malnutrition in the county government, in conjunction with different stakeholders, have been leveraging outreaches to reach the most affected communities with the aim of screening for malnutrition and initiation of treatment for those adversely distressed.
Mimi kama community health promoter niko na wengine ambao tunaenda house to house tukiwafundisha jinsi ya kula, yani nutrition, na pia jinsi ya kuzuia magonjwa, sababu mtu akila vyakula vinavyohitajika atajikinga na magonjwa.
According to the county, community health promoters, who are deemed as the backbone of healthcare delivery in Kenya through the provision of basic healthcare education and services at the community level, have helped turn around the county's nutrition indicators. Experts argue that social protection is an effective way to reduce poverty and vulnerability. Here in Kitui County, cash transfers are helping break these vicious cycles that more often than not have an impact on the general health and well-being of families.
These cash transfers are meant to help the households be able to buy what they cannot be able to buy, and basically also free them the incomes for other items.
The money was meant for food, and this food we had partnered with the Ministry of Health to ensure at least the families, the vulnerable families, know which kind of food and the food combinations are good for the health of their children and their households.
Experts argue that this approach to improved child nutrition goes a long way in helping families meet their dietary needs, as most children with malnutrition are often from families that face a range of economic and health challenges. Undernutrition is a persistent global public health challenge. To tackle the global burden of undernutrition, experts say nutrition-sensitive interventions coupled with cash transfers have a high potential to efficiently prevent malnutrition in all its forms. Gloria Milimu, KTN News.
Well, and that is where we wrap up Checkpoint this Sunday.